Dr. Julianne. I'm your Haka Life physical therapy coach. Just as a reminder, I do have my doctorate in physical therapy, and I've been a PT for about 6 years. I've helped hundreds of people in their journey to better health and helping them reach their health goals. Now today we're going to talk about hand and wrist arthritis. These tips and tricks will help both to prevent it and also help if you're already having some issues. So before we get started, what you'll need today is a rubber band, a face towel, so just a small towel, a resistance band if you have one. If you don't have one, you can use a full milk jug or a bag of dog food or a bag of flour, something with a bit of weight to it. Okay, so that's what you'll need today. Now, before we get into exercises, there are a couple things I want to mention about arthritis in general. The big one is it's very common for people as you start to have arthritis, you start to get stiff and painful that you want to stop moving. And that's about one of the worst things you can do. The more you move, the better. The moniker in PT is motion is lotion. So the more you move, most likely the better you'll feel. So let's get you moving. The other one is more specific to the hand and wrist. You want to be very cognizant of how you're gripping different objects. More importantly, the size of your grip as you're gripping them. So you want it to be about the size of the space here between when your fingers and your thumb meet. Okay, so it's not that the object has to fit perfectly in there, but whatever you're gripping, whether it's a book, a hammer, or a pen, you want it to be about that size. Anything bigger than that is going to irritate the muscles up your arm that attach to all of the tendons in your hand. Anything smaller than that, you're going to put more pressure on the joints in your hand. Okay, so those are kind of two big tips there. Now to get into the exercises, the first one, let's grab your rubber band here. Make sure it's a nice new rubber band, not a dried out one. I've definitely had them snap on me, so we don't want that to happen. So this exercise is really great for the side of the thumb and the back of the thumb. So often we spend a lot of time forward gripping this way, so the muscles on the front of the thumb get really strong and the ones back here start to atrophy or not be quite as strong. So, and that can kind of throw off the balance inside that joint. So the better we can stay ahead of it, the better you'll feel. So put a rubber band around all the knuckles and your fingers and close to the knuckle on your thumb. This one's pretty simple. All these fingers stay straight and they don't move, only your thumb moves. And your thumb's gonna go out to the side and then back towards you. Out to the side, back towards you. And I'll show you from the side here, side, back. So you're gonna do this 15 times, twice a day. You're gonna feel a good burn on the outside of your thumb there. Okay, so that's your first exercise. Second exercise, I want you to grab your towel. You're gonna fold it in half, and then we're gonna roll it up. There you go. And now rolled up, you can see it's the same size as what I said you want that grip size to be, where your fingers meet your thumb. So that looks pretty good there. And this one is a grip strength exercise. Grip strength is one of the first things that you start to have trouble with as you get older. It's also one of the first things that goes when you start to have arthritis in the hands. So the easier we can work on this, the better off you'll be. So this one, really straightforward. You're just gonna squeeze as hard as you can. Squeeze for 10 seconds and then relax. Do that 5 times, once a day, and you'll be in a pretty good spot with your grip strength. It's a good starting point. Okay, so you've got this one for your grip strength. The next one, you're gonna need your resistance band. If you don't have your resistance band, if you don't have one, that's okay. I'll show you the modification in just a minute. Okay, the resistance band though, you want it to be a little bit longer. You can see this one's a little bit longer. You need somewhere to anchor it. So that can be, you can shut it in a door, you can wrap it around a door handle in a closed door, you can wrap it around the top of a table leg, something that's really sturdy that's not gonna move on you. So I have a chair here actually, and kind of shoved it into a corner and put a book by it so it's not gonna move on me. Right, and that's kind of the bottom line. We just need something that's not gonna move. So you're gonna wrap it around there, hold it in both hands, slight bend in the knees, and then you're just gonna bring your elbows back and squeeze your shoulder blades together. Okay, so back. Now I don't have a lot of room here, but normally you can kind of start with your arms a little bit straight and then pull back, right? So here. Big thing is try not to let your shoulders come up. That's really common. So shoulder blades down and back, and try not to arch your back when you're doing this either. So you don't want to be here. You just want to be right here. Try to think about putting one shoulder blade into the opposite back pocket. Okay, so this is a really good one for the muscles between your shoulder blades. Now, why work on that when we're talking about wrist and hand problems? The wrist and hand do not operate alone. They're attached to this entire arm, they're attached to your shoulder. So the stronger we can make things up here, the better things will be down here, kind of take the load off. Okay, and this also works on grip strength a little bit too. But this one, I really want you to feel it between your shoulder blades. So like I said, 20 times, 1 or 2 times a day. If it feels really easy, up the repetitions, up the number of times you do it a day. If you don't have a resistance band, I have my trusty anatomy book here. So you can use a book, like I said, a milk jug, whatever you have, something that's a little bit heavier. And it's the same exercise. I'm just gonna kind of step back here. You're just same exercise, except you're bent forward from the hips. So bend forward from the hips, not the back. Okay, so just bend forward, so your chest is kind of towards the ground. Have the object here, and then pull towards your chest. Here, same thing, squeeze those shoulder blades together. Try not to arch your back. Okay, so not a huge change there if you don't have a resistance band. Now the last exercise I want to show you is to help with extension in the fingers. Like I mentioned before, we spend so much time forward gripping here and deflection that we start to lose our range of motion into extension. So really important to work on that. So this one's also pretty simple. You can do 1 finger at a time, or you can do all 4 of them at once. Much more efficient if you do all 4, but I'll show you both ways. We're not going to do the thumb because the joint is designed a little bit differently, and this exercise can be a little irritating for it. So to start, 1 finger, you notice I use all 4 of my other fingers to support it, and then you're just going to pull that finger back. And we can do same thing on every finger. You're going to hold it for 10 seconds, or all 4 at once. Notice I use my whole hand and my palm of my hand to pull back just to where it's comfortable. Notice my wrist is not bent down or back. It's going to be kind of neutral, and my elbow slightly bent here. Okay, so that's kind of what you want. So 10 seconds, 1 or 2 times a day. Kind of the more you do it, the better, especially if you're spending a lot of time sitting in a computer. Just take a break, stretch back, and do extension. Okay, so those are our tips and tricks for hand and wrist arthritis. I hope you've had a good time. I've certainly enjoyed chatting. And remember, at Haka Life Nutrition, we believe in a whole body approach. Get moving daily, eat well, and supplement when you need to. And you, my friend, are a warrior.